Why is carbon monoxide so dangerous is because it actually binds really tightly to hemoglobin in your red blood cells. Because one of the things that helps us to sleep soundly at night, we know that because of its pathway mechanisms, it's going to be important for healing and recovery from musculoskeletal injuries. Every organism, from single cells to have NAD, can't live without it. Your immune system needs hormones, so you've got to look at hormones. You've got to look at all the mechanisms.
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
Is there anything to be done to reverse the damage of long-term carbon monoxide exposure? That's an interesting question because we always are familiar with acute exposure to carbon monoxide, right? We have our carbon monoxide detectors and we get this acute exposure and people get very sick or they even die, right? Why is carbon monoxide so dangerous is because it actually binds really tightly to hemoglobin in your red blood cells. So it actually reduces the amount of oxygen that can get to your bloodstream, so that are oftentimes from common household items, cooking appliances, exposure to exhaust fumes. There's not really a way to test for people to have carbon monoxide poisoning because you can test something called carboxyhemoglobin levels in people with acute toxicity, but that doesn't work for chronic toxicity. It's not detectable. They have to be suspicious. And if people have those symptoms, have them maybe go looking for exposures. And then what do you do? Or what do you do if you think maybe this is something going on? Well, probably about the best treatment is hyperbaric oxygen therapy, NAD. What is it? What does it do? And who should take it? For those of you who don't know what NAD is, it stands for nicotinamide adenine dinucleotide. And basically every organism, from single cells to have NAD, can't live without it. It's a molecule that's critical to mitochondria. It helps convert food energy. So basically turns food into energy. It's a really important shuttle to transfer electrons from one molecule to another within the cell. So it carries out it's necessary for almost every reaction process in your body. You could not survive without NAD. Okay. It also regulates circadian rhythm. I can't emphasize enough that this is a critical molecule and its levels drop with age. So makes sense. We should just give more NAD. All is fine. Levels drop when we age. We give more. We fix all these problems, except not so simple. The problem is that NAD is dropping because of other things going on. Stephanie asks, do you have any general advice for those of us who suffer from insomnia? What type of treatments are available in your office? God, it's such a tough one, Stephanie, because lots of times our insomniacs come to us on they've been on Ambien and they've been on all these drugs and first all you have to get people off of the drugs. So you have to get people off of those medications that sometimes they're sort of thriving on, it's the only thing that's sort of keeping them asleep. And yet it's disrupted everything so much. And then what we'll do is, number one, back to make sure hormones are optimized. You are not going to sleep if your progesterone levels are too low, right? Or all the necessary minerals there to help with normal circadian function. You need zinc, you need selenium. Those are all really important for circadian rhythm as well. And then if people aren't sleeping, now we start going to some of the sort of reset peptides like epitalon, right? Or something called DSIP, which stands for deep sleep inducing peptide. And then the growth hormone secretagogues are critical here too. Because one of the things that helps us to sleep soundly at night is an upsurge of growth hormone. As we age, we don't get that growth hormone surge at night. So it's really important then to use like the growth hormone secretagogues, CJC and ipamorelin or tesamorelin and ipamorelin before you go to bed, and you get this nice growth hormone surge at night, which helps with deep sleep. What steps can you take to boost the immune system from past infection and from COVID? People who have been knocked down by COVID, their immune systems aren't recovering very well. People who have recurrent illnesses since then. So I think, number one, making sure all the other health is optimized, right? For instance, your immune system needs hormones. So you've got to look at hormones. You've got to look at all the micronutrients. We know that micronutrients like vitamin A and zinc, selenium, really important as well for immune function. You can literally eat, 3 Brazil nuts a day and get some upregulation of selenium. So that's an easy one to fix. Vitamin D, got to keep your vitamin D levels high, 80 to 110. It's really important because it stops viral cell entry. And I want to bring in 2 things I think people don't think about in terms of immune health. One is fiber. Nobody eats a high fiber diet. For every 10-gram increase in dietary fiber, the mortality rate from an infectious or respiratory disease decreased by 30%. Benefits of thymosin beta-4 for healing from musculoskeletal injuries. So thymosin beta 4 is one of our thymic peptides, kind of critical for tissue repair. So it actually regulates a bunch of pathways to encourage tissue repair without fibrosis. So the problem is we don't want to repair tissue with scar. Let's say you tear a tendon. Why do you keep tearing that tendon? You keep tearing that tendon because it heals with scar, not nice normal fibroblasts. So now you go out and do something again, tears again. So what you've got to do is get that to heal with nice normal fibroblasts, and thymosin beta 4 is critical to that, right? It's a naturally made peptide. It's just we don't make very much of it after our thymus gland involutes, which starts around puberty. So basically, it works on the TGF beta pathway to attenuate fibrosis, and something called the WNT pathway, Wnt pathway, that actually is really important for arthritis. We know that because of its pathway mechanisms, it's going to be important for healing and recovery from musculoskeletal injuries. Branched chain amino acids are one of the biggest stimulators of mTOR. Are they safe if taken together with other amino acids? There's really a lot of conflicting information out there about protein. So we have two competing pathways in our bodies. mTOR, that's our growth, that's our muscle building, and then AMPK. AMPK is kind of pro-longevity. In general, for longevity, we do want AMPK up and mTOR suppressed. But if we do that all the time, if we always have mTOR suppressed and AMPK elevated, then what happens? We get sort of frail. So yes, they live a long time potentially, those people in high AMPK, low mTOR state, but they end up frail, decrepit, hip fractures, no muscle mass. So we do know that lower protein diets extend lifespan. So protein restricted diets extend lifespan. So here's the problem. Higher protein, you raise mTOR, muscle building, right? But we know that lower protein, more associated with extending lifespan. So how do we fix that problem? Because it is a big dilemma on protein. Do I protein restrict? Do I not protein restrict? What are the key blood indicators that would suggest you may have a metabolic disorder? So this is basically a development to poorer response to when we eat foods, we become more and more insulin resistant over time, and that's detriment to our longevity. The simplest indicator you can just do at home is look at waist circumference. Waist circumference is a really good predictor of insulin resistance. In men, a waist greater than 37 inches, and in women, a waist greater than 31 inches is corresponding to fatty liver disease, more insulin resistance. So that's a really simple indicator you can do at home. Then from a blood marker things, look at the triglycerides, particularly the triglyceride to HDL ratio. You want that ratio as close to 1:1 as possible. And then look at fasting insulin levels, not fasting glucose, fasting insulin. Your fasting insulin levels need to be less than 6. Okay, so when fasting insulin levels are above 6, you're starting to trend towards insulin resistance as well. I will direct you guys, go to our Labs 101 quick course, because that actually goes through some of this stuff. We actually discuss all of these labs and which ones are sort of markers of metabolic health. So what is VIP peptide, and does it support mitochondrial health? And when would you use it? Vasoactive intestinal peptide, or VIP, is that's another peptide we naturally make in our body. It's a neural peptide. It's a really important neuromodulator and neurotransmitter. It also is a potent vasodilator, so it opens blood vessels, relaxes smooth muscles. It's good for blood flow to the GI tract, epithelial cell secretions. It's most used more in inflammatory disease processes. It's decrease in inflammatory cytokines, and it's particularly as a nasal spray for like biotoxin illnesses, things like that. You can use it as a nasal spray, or for pulmonary issues, patients with asthma, like for instance, who have asthma or viral illnesses that have caused damage to the lung nerve fibers, and you start getting a fibrotic response to the lungs or pulmonary.